disparity in terms of earnings by gender, where females are considerably lower in comparison to males. You can see we're kind of averaging anywhere from 35 to 40%, depending on the education level, lower earnings in the past 12 months. Next, we're going to look at poverty. So McHenry County, as of 2019, had 7% in poverty. This was 7.9% lower in comparison to 2014, which is kind of a relatively small difference. We do have significantly lower poverty, though, than Illinois and the United States. We have 44.0% lower for McHenry compared to Illinois, and 47.8% lower for McHenry compared to the United States. In terms of demographic differences, the percent of the population in poverty is 2.6 times higher for those who identify as Black or African American compared to those who identify as white, and it is 3.4 times higher for those who identify as other race compared to those who identify as white. It is also 3.2 times higher for those who identify as Hispanic or Latino compared to those who are non-Hispanic white. So again, representing significant disparities in our community based off poverty level. In terms of the percent of the population below the poverty threshold within McHenry County, these darker areas that have a higher percent of those in poverty, and it's really only 11% or more, include Harvard, Marengo, part of Woodstock, and part of Crystal Lake, and part of McHenry. In terms of employment and unemployment, in 2019, 67.5% of the population was employed in McHenry County. This could, of course, be drastically different after COVID, so we don't have current estimates for COVID for this, but likely there is a big change in both employment and unemployment after COVID. In comparison to McHenry in 2014 and Illinois in the United States in 2019, we do have a higher percent of the population employed. We also have a lower percent of the population who are unemployed in comparison to our 2014 data. So next, I'm going to turn it over to Maura, who's going to talk about some of the perceptions from our Healthy Community Study.
Hello. So in the Healthy Community Study, residents were asked to indicate any key perceptions of McHenry County. These are important to understand the needs of the community. From the community study, the top three perceptions top three strengths of McHenry County were indicated as low crime and safe neighborhoods, schools, and clean environment. And key informants indicated that the top strengths of McHenry County were medical services, parks, green spaces, and conservation areas, and mental health and substance abuse services. Focus group participants also indicated that parks, green spaces, and conservation areas were a strength of McHenry County. However, the focus groups do not represent the county as a whole and are added as supplementary information to determine the thoughts of the community in more detail. Focus groups indicated that the top challenges of McHenry County were transportation, high cost of living, including taxes, and the Spanish-speaking focus group indicated that services were not available in Spanish. Focus group challenges are not ranked in order, but these are the top three that were selected. Key informants indicated that the top three challenges were transportation, substance abuse, and affordable housing. The community health survey did not ask about challenges. We do not have data regarding that. The community health survey also asked about top health concerns, whereas the top three were mental health problems, alcohol and drug abuse, and obesity and overweight. Key informants were asked to select the top three health concerns per age group, which are also not ranked. So for ages 0 to 4, the top health concerns were screening, early intervention, and developmental services. For ages 5 to 29, there's substance abuse, mental health, and access to medical services. Ages 30 to 64, it's mental health, substance abuse, and chronic disease. And ages 65 and up are chronic disease, access to medical services, and mental health. The focus group participants also indicated that substance abuse, mental health, and access to medical services are the top health concerns in McHenry County. I'll now hand it over to Chloe to discuss maternal and child health.
All right. Hi, everyone. So I'm going to go over a couple different sections. I'm going to start off with maternal and child health. So most of the data that we pull for maternal and child health comes from the CDC Wonder online database. And so if you ever go onto the CDC's website for it, you can look at birth statistics, death statistics, things of that nature. So here we are presenting most of our data that you'll see from now on is going to be represented by a rate of some kind. And so for this first one, we're presenting as a rate as per 100,000. So essentially, it's just a way of standardizing to compare groups of different population sizes, like with different demographic groups or different geographic areas. So on the left, you see that the birth rate for the last 10 years of McHenry, Illinois in the US. So we can see for McHenry, which is that green line on the bottom, is a slightly decreasing trend for the county, and the birth rate is lower still than the state and the US. So there are some demographic differences in birth rate that we see. It's 49.5% higher birth rate for those who identify as Black or African American compared to those who identify as white. It's 37.9% lower for those who identify as multiracial compared to those who identify as white, and 71.7% higher for those who identify as Hispanic or Latino compared to those who identify as not Hispanic or Latino. So this slide represents the annual trends in maternal birth characteristics for the county over the last 10-year period. So when you see an equal sign, it indicates that it's stable, and then any of the arrows either indicate an increase or a decrease in the trend. And then the colors that we use, so green indicates good, red is bad, and then blue is going to be neutral. And so then these specific maternal birth characteristics were chosen because these are standard indicators that you'll see throughout healthcare to determine whether birth characteristics are either good or bad. So for the ones that have remained stable, it's going to be the rate for unmarried mothers, births that were cesarean delivery, births that were low birth weight, and births that were preterm. Where we're improving over the last 10 years are we had a fewer number of mothers that had less than a high school degree, fewer adolescent pregnancies, and fewer mothers who smoked during their pregnancy. And then where we could improve more, where we've gotten worse over the last 10 years, is that we've had a decrease in the number of mothers who had first trimester prenatal care and an increase in those mothers who had late to no prenatal care. So additionally, we can look at various maternal birth characteristics and compare McHenry to both Illinois and the US. So in almost all instances, you can see that McHenry has fared better than both Illinois and the US. And so where you see those equal signs, it means that we had either a marginal difference or less than a positive or negative 10% difference, which we decided as a group would be approximately similar to each other, so we indicated that with that equal sign. So how you could read this chart is that 28.8% fewer births were to unmarried mothers in McHenry compared to Illinois, and 20.5% fewer than in the US. We also had significantly less births to mothers who had less than a high school degree compared to Illinois and the US, less for adolescent pregnancy and smoking during pregnancy, late to no prenatal care, low birth weight, and then for preterm birth, we were better than the state. However, we were the same as the US. Right, and then on this slide, when we looked at specific demographic differences, we also looked at ethnicity. So when we compared those who identify as Hispanic compared to those who identify as non-Hispanic, all but one was worse for Hispanics. So the way you would read this one is that there are 2.1 times more unmarried mothers who gave birth in this period compared to non-Hispanic mothers. There are 9.4 times more births to mothers who had less than a high school degree compared to non-Hispanic mothers, 4.2 times more adolescent pregnancies to Hispanic mothers compared to non-Hispanic mothers. There were 13.9% fewer cesarean deliveries, though, for Hispanic compared to non-Hispanic. There was 17% less Hispanic mothers who received first trimester prenatal care, and 62.2% more Hispanic mothers who did not or who received late or no prenatal care. So for this one, other demographic differences, but for race, so in each instance, the racial groups will be compared to white. So anytime that you see the circle with the slash, it should be, it kind of looks black here, but it's green. That means that there's no difference that could be calculated due to suppression. You'll notice that we don't have all races on here as their values were also excluded due to suppression. So for unmarried mothers, we couldn't include the data because it was suppressed, which is why it's got that circle with the slash. There were 2.1 times more births to unmarried mothers that identified as Black or African American compared to those who identify as white, and 71.1% more births to unmarried mothers who were multiracial compared to white. For cesarean delivery, Asians had 20.1% more births that required cesarean delivery than those who identified as white, 32.5% more cesarean deliveries for Black or African American mothers compared to those who are white, and then the data was suppressed for multiracial compared to white. As far as first trimester prenatal care, Asians and multiracials compared to white were about the same. However, there was 29.2% fewer births that had first trimester prenatal care for Black or African American compared to white. And then finally, for maternal and child health, we can look at infant mortality. So McHenry's infant mortality has historically been lower than the state in the US. However, starting at 2018, you can see that the county's infant mortality rate rapidly increased and has surpassed the state and national rates since. And I'll also be talking about disease burden. So disease burden is the impact that a disease or a condition has on a community. So that disease burden is measured by 3 different things, including mortality or deaths, hospitalizations, and prevalence. So how prevalent is it in the community, or how frequent do you see it in the community? So for here, age-adjusting rates. So earlier we were looking at just regular rates, birth rates, and then now we're going to be talking about age-adjusted rates, which is a way to make fair comparisons between different age groups, accounting for how old the population is. So, for example, if a population has a higher percentage of elderly individuals, they might see that there's a higher rate of death or hospitalization than a county that has a younger population, solely because a older population is more likely to be hospitalized or die. So age adjustment can make different age groups more comparable. And so anytime we have an age adjustment, you'll see it on there that it will indicate that it is age adjusted. So when we look at the overall mortality trends over the last 10 years, McHenry is lower than both Illinois and the US, but we're still all following similar trends. We had a decreasing trend until about 2019, where you see that there is a little bit of a spike for everybody, and that's likely due to deaths from COVID-19. So additionally, there are demographic differences in mortality. Individuals have a higher mortality rate. On the right, you could see if those who identify as white were 2 times more likely to have died compared to those who were Asian or Pacific Islander during this 10-year period. Those who identify as Hispanic or Latino were 39.4% less likely than those who identify as not Hispanic or Latino to have died, and males were 36.1% more likely to have died earlier than females. The differences for the ethnicity could be attributed to the fact that, as we mentioned earlier, with the different distributions in our population, that we do have a younger Hispanic population and an older population who identifies as not Hispanic, white. So for mortality, you can see here that these are the leading causes of death determined by the World Health Organization 113 cause list. So this leading causes of death list is a standardization, like I said, used by the World Health Organization. It groups different causes of death based on ICD-10 discharge codes into a larger grouping of 113 causes of death. This is a standard practice in the field to rank causes of death. It uses a crude rate of death, which is within a defined population, and then ranks them. It is the standard ranking for causes of death. So here we look at the top 10 for the county. So something to note is that there's a pretty major drop-off between the first 2 and then COVID-19, with it still being about twice as high as the death below it. The top 4 are malignant neoplasms or cancer, followed by diseases of the heart, COVID-19, and then accidents or unintentional injuries. So accidents include overdoses and alcohol poisoning. So not included in the slide, but can be found in our report, are the leading causes of death by age group. So the younger the age groups are, the more likely you were to die from an accident. And as you get older, accidents drop farther down on this list, and cancer becomes more of the more common ones in its place. So later we'll present demographic differences on death as well as hospitalization. We focused only on the 4 leading causes of death. So for hospitalizations, we're going to take a look at the top hospital discharge codes for McHenry County. So discharge diagnosis codes do not necessarily code for just the primary reason of somebody's hospitalization. So for example, if someone were to have a heart attack and was hospitalized and then ended up getting tested for COVID upon intake and they found out that they were positive, COVID is likely going to be on their discharge diagnosis because we can't assume that the COVID-19 diagnosis was not going to affect somebody's overall treatment and their outcomes. So in the example I provided, COVID could potentially make those recoveries more difficult. So for example, on here, anemia is not necessarily going to be one of the top discharge codes for McHenry County on its own. It's likely going to be co-occurring with other hospitalization reasons, either negatively or possibly negatively affecting your treatment. So the top 4 leading causes of death in the county are diseases of the heart, nephritis, nephrotic syndrome, and nephrosis, essential hypertension, and hypertensive renal disease, and mental health and behavioral disorders other than dementia and substance abuse. Some caveats: essential hypertension is also included in diseases of the heart, is being double counted, but however, it is still a top discharge code. Mental and behavioral health is often coupled with both physical and mental conditions listed on their discharge diagnosis, and mental health hospitalizations on their own, though, are significantly lower, but we cannot distinguish whether or not a mental health diagnosis was the primary reason of hospitalization. For that, it might be an overestimate. You can see the top hospitalization codes in order of the crude rate, and using those hospital numbers, we also were able to determine that there were some demographic differences. So the hospitalization rate was 47.5% lower for those who identify as Hispanic or Latino compared to those who identify as non-Hispanic white. It was 55.4% lower for those who identify as non-Hispanic Asian compared to those who identify as non-Hispanic white, and 2 times higher for those who identify as non-Hispanic other compared to those who identify as non-Hispanic white. So for the adult disease prevalence, in the Healthy Community Study, participants were asked what physical and mental health conditions they were diagnosed with. The most prevalent are high blood pressure at 33.8%, arthritis at 28%, mental health disorder at 18.7%, and asthma at 15.8%. A caveat of this data is that it is self-reported by participants. These numbers could potentially be underreported, with people not wanting to potentially share their medical condition. We also don't have any accurate data for youth disease prevalence. We used the Illinois Youth Survey data when it was available, and we will point that out during this presentation. So some of the the geographic differences in disease prevalence. The prevalence of arthritis in McHenry County was 15.2% higher than Illinois. The prevalence of arthritis in McHenry County was 16.2% higher than in the United States, and the prevalence of asthma in McHenry County was 29.5% higher than in Illinois. So there were no other geographic differences that were found for disease prevalence. And then another leading cause of death was accidental deaths. So the number 1 cause of accidental deaths, as you can see in the table, was accidental overdose, followed by falls, motor vehicle accidents, and other. So accidental overdose deaths were 94.6% higher for males compared to females. And additionally, McHenry County, Illinois, and the US have all had increasing trends in the accidental death rate for the last 10 years. And the spike in 2017 is likely due to the increase in overdose deaths that occurred in McHenry County that were identified at that time. And then I'll also be talking about chronic disease. So we will be showing chronic disease information identified by the Healthy Community Study or among the leading causes of death or top hospitalizations. We've grouped them into this part of the presentation. So in the Healthy Community Study, participants were asked which diseases they have been told that they had. Their responses were then evaluated for demographic differences. So men were more likely to have high blood pressure compared to women. Women were more likely to have asthma or autoimmune diseases compared to men. Those who identify as white were more likely to have high blood pressure, arthritis, or cancer compared to those who identify as Hispanic or other races and ethnicities. And those who identify as Hispanic or other races and ethnicities were more likely to have asthma compared to those who identify as white. And as mentioned earlier, in this instance, other races would include Black, Asian, other, multiracial, and these were all combined because in the NIU Healthy Community Study survey, the way that they were able to grab all of their data for it, they weren't able to get enough sampling from these racial groups, and so they combined them into others so that their data would be included. Additionally, there were demographic differences by income level, so low-income households were more likely to have asthma or heart attacks compared to those of mid to high-income households, and those who were 65 and older were more likely to have high blood pressure, arthritis, cancer, diabetes, angina or coronary heart disease, COPD, emphysema or chronic bronchitis, heart attack, stroke, or kidney disease compared to those who were 18 to 64. So then now for cancer. Cancer deaths in Illinois and the US have been steadily declining, as well as for McHenry. It's had a little bit more fluctuation, but it is still very similar to what we're seeing at the state and national levels. There's a little bit of an increase after 2019, but overall it's been a decrease over the last 10 years. So the table breaks down the different cancers by cancer site and provides the age-adjusted death rate as well. So the top cancer site for 2020 was bronchial and lung cancer, followed by colorectal, breast, and pancreas. And then when you see, it says at the bottom, all other sites of cancer, we only included cancers on this list if they had 20 or more deaths. All the other ones that had less than 20 would have been combined into all other sites. So there are some demographic differences in mortality for cancer. So those who identify as not Hispanic or Latino were 21.5% more likely than those who identify as Hispanic or Latino to die from cancer, and males were 29.4% more likely to die from cancer than females. McHenry has been experiencing small decreases up until 2019 for diseases of the heart. This increase, as you can see, is also affecting Illinois and the US, could potentially be stemming from the effects of COVID-19, but we can't know for sure, but it still is historically lower than US and Illinois. And then you can see in the table, similar to the other ones, the age-adjusted death rate, the top diseases of the heart are chronic heart disease, heart failure, and heart attack. And then some of the demographic differences for mortality of disease of the heart. Males were 51.3% more likely than females to die of disease of the heart. And additionally, when it came to demographic differences for hospitalization due to diseases of the heart, males were 44.5% more likely to be hospitalized for a disease of the heart, and 18.5% more likely to be hospitalized for hypertension when compared to females. When comparing geographic differences with McHenry and Illinois,